What's up, everybody? I'm Dr. Jordan Taylor, undergraduate exercise science program director and associate teaching professor at the University of Kansas. I'm here with Dr. Yi Song, assistant professor at the University of Kansas and director of the Biomechanics laboratory. Today we're going to provide a tour of Dr. Song's lab, discuss the type of research conducted in the lab, and talk about some of the equipment and instruments that are used in this lab for research purposes. All right, so Dr. Song, what type of research do you conduct in your biomechanics lab, and then why is this research important?
So in biomechanics lab, what I'm primarily focused on is using biomechanical method to understand the primary and secondary ACL injury risk and mechanisms. So speak to ACL, that is anterior cruciate ligament, which is a ligament inside of the knee joint. It's very important why we're saying that, because ACL injury commonly happened in sports activities when you're doing a landing or changing direction. And it also causes a long absence after playing because it takes forever, not really forever, but it takes a long time for players to get back to return to play. So that's what I'm focusing on. And speak to biomechanical method, we usually use three major progress or major approaches. So first one is motion capture system that can tell us about how you are moving and what is a movement, it quantifies.
So there's cameras up around in the lab in here. Yeah.
Yes. And second one is force plates. So those three-dimensional force plates can tell us how much force you're applying to the ground, as well as where this force vector is, if it's close to a toe or if it's close to a heel, because later on that's gonna be an effect to your joints while you're doing a jump landing. Last one, we also use some sensors to measure how you're contracting your muscle when you're doing such activities. So the best part is they all talk with each other. We can integrate everything together so that we know at this moment how you are moving, how much force you're applying, as well as how you're using your muscle.
Yeah, you've got the cameras to monitor the subjects. You're looking at using the force plates to determine how much force they're putting into the ground, and then how you apply the force into the ground then determines the work that your different joints are doing, like your ankle, your knee, your hip. Yep. And then you have the EMG, you're using EMG sensors on different muscle groups to look at muscle activity while you're doing different movements, which some of this you're going to talk about in one of your research studies when we get to that. And then maybe just, since this is called the Biomechanics Lab, for people that don't know what that term means, some people are like, what is biomechanics? So can you maybe explain just what that term is?
Yeah, exactly. So when I really talk with my students, when you go home, talk with your grandma, what is biomechanics? You just body physics. And I think that's a very easy, understand term for exercise science major. We can not only we definitely can look at different biology perspective, such as human movements, as well as maybe animal, such as how cat is landing on those things. But for our lab and our program, we definitely have a major focus on human subjects. So that's a bio part. For mechanics part, we're usually describing what happened. That is about kinematics. So if you want to use some biomechanical term, and kinematics is about okay, today you're running pretty fast, and how fast it is, that is velocity. All those are kinematics describing. And what else we're also talking about is why it caused this. So that is kinetics. So how much force you're applying. We're trying to explain what has been done and why it happened. So adding those together, we call it as mechanics. So with the focus of human subjects together, that's what we call as biomechanics.
All right, thank you. So yeah, a lot of describing motion, that's your kinematics, and then how forces are producing motion, your kinetics. And I think that pretty much answers it. You want to move on to the second one?
Yeah, of course.
So you talked a little bit about describing what you do as far as research in here and what biomechanics is, that field of study. Maybe what are some things you measure in the lab, and then what types of equipment and instruments are you using in the lab to measure things in your research studies?
Yeah, definitely. So as we talked about the three major approaches we are using in biomechanics, we are lucky we got all those most updated equipment in the lab. So it allows us to do lots of research projects, look at different perspectives. So for example, for motion capture system, we definitely can understand while you're doing, for example, like just walking, what is your angles? Like that angle can be joint angle, segment angle, for example, how you are flexing your trunk, how you are bending your knee, how you are pushing the ground. That is more about angles part. But
so it's like gait analysis.
Exactly, as well as like the jump landing analysis. That is another like different focus, but we all can conduct it. We all can do it. So then for the angles part, it's not only giving us a angle, but also like three-dimensional. That is very important for like in a research setting, because sometimes you're not only want to understand how you're flexing, but also medial lateral directions such as knee valgus, so knee varus, or maybe axial rotation, internal rotation, external rotation. So our cameras allows us to do all those three-dimensional angles. And then for force plates itself, we can understand as like how much force you are applying. We usually do it normalized based on participant's body weight. So a common way we're quantifying or tell our participants is, while you're landing, you're actually applying more than 3 times of your body weight to the ground, which is huge, and that can be something maybe affect your injury risk factors. So that's something we can talk about the force itself. And
commonly, that's how the ACL gets injured, is like non-contact injuries, changing direction, landing from a jump.
Yep.
Maybe it's a volleyball player at the net trying to spike, they land on one leg, and that ACL goes because, like you said, 3 times your body weight landing forces. That's pretty so significant.
True. Exactly. So then but adding on the top of it, if we combine the motion and the force, what it offers us more is the loading itself. We definitely can use some inverse dynamic approaches later on, do some programming to calculate how exactly that is more than 3 times of your body weight applied to your specific joint, such as how much you're experiencing during this motion on your knee joint, on your ankle joint, as well as your hip joint. So those really give us lots of capacities to understand what's happening here. And lastly, if we bring like EMG sensors into the conversation, it will tell us, okay, at this time, did you really using your quadriceps, or how much activation you're comparing or you're doing from your quads as well as your hamstrings. I'm really focusing on lower leg, so I brought several examples from like lower leg muscles. So that's generally giving us a big picture of what we can do and what we're doing by using biomechanical approaches.
Is there anything you can think, before I go on to the third question, we're going to talk about one of her studies that was just published in the lab, but when you were talking about gait analysis and using the force plates and also looking at muscle activation with the electromyography, the EMG sensors, what do you typically maybe see? This is just something I thought of. Like after someone has had an ACL injury, maybe it's 6 months after they had that injury, they had the ACL reconstructed, maybe like with their gait and some of these tools that you use in the lab to measure, what do you see? What differences maybe stand out on that injured limb versus the uninjured?
Thank you for asking that. It's actually such an interesting topic to think about. And previously, we actually conducted some research to look at post-ACL injury, like the rehab progress, how that gonna goes like in general. So just thinking about biomechanical research method we just talked about, and it's definitely we're in a lab setting, but at the end of the day, what do we want to do? We definitely want to use the knowledge we learned from the lab, applied it to practitioners, applied it to PT clinics, make it more applicable. So that's definitely one of the goal I'm doing, the research we're doing here. So speak to the what happens with post-ACL injuries. So what we found is not only I think researchers found if you want to let's say this. So what the patients want is maybe you trying to have a longer time before you're like between the ACL injury time and ACL reconstruction time. So during this period, you want to try your best to get a symmetrical like gait pattern. You're trying to recover and then you are doing the ACL reconstruction. So what they found is actually longer time between ACL injury and ACL reconstruction associated with a decreased injury risk for ACL re-injury. So I thought that is something very interesting.
That is interesting. It seems counterintuitive, but yeah.
And I thought that is interesting. And another thing we looked at is from our previous study is to look at the squat. So what we do is after ACL injury, like quadriceps atrophy commonly happen, definitely one of the goal is to strengthen your quadriceps. So then squat is definitely one of the most common way we're doing it. And it also add a little bit weight to your ACL, which is good later on when you build up the muscle strength. So then what we found is patients being educated very well to try to use their injured side. But sometimes it just so common happened to favoriting the non-injured side. So what they did is they are moving their hip medial-laterally to the non-injured side. So that's so common happened around 6 months following ACL injury. And later on, during later phase, about more than 1 year following ACL injury, it has been better. But when you are doing counter movement jump, it's getting similar thing. So when the task is more challenging and faster to educate it, put that in your spring, you cannot really like help yourself in that way. So that's a previous finding we had. That's also a study with population work with NCAA athletes before. So by like applying it and using it in a clinic setting, we just talk with our practitioners, so like maybe physical therapists. When you're doing a squat, look at where the client's hip is relatively to their like standing foot, relatively to their ankle. You want to make sure they're aligned and in a neutral position.
I know one of the things I used to do, this just made me think of it, when you talked about the hips shifting when someone is injured, obviously human nature is you want to shift the hips away from the injured knee so that you're putting force into the ground more with the non-injured leg. And I remember one thing I used to do when I was a strength coach working with athletes, now this was a long, quite a while. You're looking at maybe 9 months to a year after they'd had their ACL reconstruction, had been released from physical therapy, and I would work with them. We would do like banded squats where they would squat down, but I would have a band around their pelvis and pull them towards the injured leg. So then that would require them to put force into the ground and push with that injured leg and the quadriceps and the knee, and then to stabilize them, or the band would pull them off. So it was teaching them, forcing them to use that side that they'd been going through rehab, they'd had reconstructed, and they get more comfortable using that injured leg. So you literally, like if the right knee was injured, that ACL was what was reconstructed, have a band around the hips, I'd be standing over here to the right, pulling them towards that, and they'd have to squat, and then they've got to push back into the band so they stay balanced.
That's awesome. I'm glad you bring that up to here. It's because definitely not only like strengthening the injured side, but also the way we are using resistant bands, it definitely encourages the muscle activation, and we call it like dynamic controls. Right? So that is definitely important for ACL. And especially when you put it around the hip, sometimes we think gluteal medius, like those muscles are very, play a role in like knee valgus. You don't want the knee like touching each other, especially for female athletes. So I think that's such a great like way to do it.
And what Dr. Song means by that knee valgus, so you have a muscle on the outside of your hip called the gluteus medius, and it helps you abduct the femur, your thigh bone, and bring it out. So if that muscle is nice and strong, it helps keep the thigh aligned under the pelvis, and it prevents the knee from collapsing inward, and that's your valgus stress. So there's a lot of muscles up in the hip that you need strong, and down around the foot, the ankle, all play a component in that knee remaining aligned. Because like you said, if you get a lot of valgus stress at the knee and the knee caving in, that puts your MCL at risk, your ACL, some of those ligaments. And of course, quadriceps and hamstring strength, those thigh muscles, that's important too, so that you don't re-injure the ACL or have an injury in the first place.
For sure. So,
well, Did you have anything else you want to say, or do you want to move on to the next one?
I just thought about another way we found about to strengthen the quad is like, or using the injured side is just simply lift it up. And I thought that is so easy to do, and which is also very helpful because once you lift one side up, like, one side, you cannot like really use compensatory strategy to look at that. So I found that method or show that during some lab classes to my student, it has been worked very well.
Right, so like unilateral training. Are you talking almost like quad sets, like lying supine and?
I think it's just when you're doing squat, lift one side and put like somewhere like very low weight and just stand on.
I understand what you're saying now.
So
okay.
That's really like, I think it's very easy to achieve and also works well.
Okay, I understand. I pictured it in my mind differently. So, okay, we'll move on to number 3 here. So let's discuss your recent paper that was published in 2024 in the Journal of Sport and Health Science. So the title of this paper is Hopping Backward to Move Forward. I like that. Single leg backward hopping can better detect decreased quadriceps strength induced by a fatigue protocol compared to forward and vertical hopping. So maybe can you provide some background information about this study and why it was important to conduct this, and maybe also how are patients typically assessed during rehab after they've had their ACL reconstructed in the knee?
Yep, for sure. So for this big picture wise, what we are trying to do is exactly what we talked about early. We are trying to make our research applied, and what can we do by collecting evidence in the lab and apply it in PT clinics. So what we found is we're trying to bring up an easy measurement to clinics so that everybody can maybe more sensitively and accurately measure where your knee is. So
because some PT clinics, they may not have a vertec, like there's a vertical jump measuring device back here. They may not have jump mats and force plates and other things like that. You have high-tech equipment in the lab. So you're looking for a simple way to measure, how much work the knee is performing, quadriceps strength, a simple measurement that any PT clinic or PT could use on their patients to kind of track their progress during recovery.
Yeah, exactly. And also consequently decrease ACL re-injury risk. So first, why we care about ACL re-injury risk? Because if you look at the primary ACL injury risk and the secondary ACL injury risk, ACL re-injury risk is actually 15 times higher than primary ACL injury risk, which means if you get ACL injury, more than likely 20% of patients get another ACL injury. So that's why we care about it. And then second, when you are evaluating it, to look at where your knee is, what can we do in order to make it more efficiently? So what we found is in PT clinics today, lots of them there is testing barriers to talk about if you're ready to return to play. And a single forward hopping is such a most popular task we used.
And when do they usually in the rehab process utilize that? Like, let's say it's a patient, they've had the ACL reconstructed, they've had surgery. When is that functional assessment typically done in a PT clinic where they're measuring, because that's further down the road, if they're going to be measuring their forward hopping distance to see, because there's all these milestones you have to hit to get back to return to play to the field or the court. So when do they measure that forward hopping in rehab?
I will say in general is about 6 months.
Okay.
Following it, your first job is you really achieve a better range of motion after ACL. And then later on, you're trying to slowly add a little bit weight on it. And then once you're able or you feel comfortable with it, and most of the time is about 6 months following ACL reconstructions. And during this time, our PT clients trying to measuring the single forward hopping distance on both legs and look at the line asymmetries between legs. So that it looks like, okay, if your injured side recovery the same as your non-injured side. But there are 2 questions what research has been well documented. First one is, although the non-injured side is non-injured, it's changed because the injured side. So you cannot really use it as a reference. Second one is when you're performing single hopping tasks, later about 6 months or even later following ACL reconstruction, you're really using your hip and ankle to compensate instead of only using your knee. So single leg forward hopping distance cannot like guarantee what happens here. So then,
right, because I read in your paper, and I thought you explained this well, that with a single leg forward hop, about 85% of the work is performed by the muscles around the hip joint, and then the ankle.
Yep.
And so then about 15% is left, the work is on the knee with forward hopping.
Yeah, so we're thinking, okay, so if single leg forward hopping cannot, like, it's not that good, what can we do? So recently, researchers found like maybe vertical hopping is a good one. So there are studies to conduct that and look at how about single leg vertical jump height. But there is the thing is, it's easy to, not that hard to measure single leg vertical hopping like height, jump height. It still requires external, like extra equipment. You will get maybe a vertex like what we're having in the lab or jump mat, and it's not that like, it cannot provide live feedback such as single leg forward hopping. So you still need to wait, okay, what is your height? Something like that. So then what we're wondering, can we find something like even better? So we found a study actually looking at like double like jumping like some sort. So from that study, we looked at, okay, actually when you are hopping jump backwards, you are using more than 3 times of your knee compared to forward and vertical hopping. So this really brings us interest to look at if you're really like the knee demands is that much, can we really use this single leg backwards hopping as a task to evaluate where your knee is? So that is our question here.
Yeah, maybe like a better metric, or maybe not better, but at least a valid metric that you could use to assess how that knee is progressing to rehab. Because like you said, if it's 3 times more work there, then it's like, the quadriceps is really having to kick in and activate there. And obviously we know, if you have an ACL injury, that quadriceps atrophies a lot, like you said. So it's very important to get the strength back in that muscle. And so you feel that that's what led basically into this study is, well, let's look at backward hopping. And you think about it, it's like, well, if you backward hop, you're putting force, down and forward into the ground. So you're going to translate, your body's going to move backwards. It's a posterior force.
Yep.
And I know from experience, just thinking back to some of my strength training with football and stuff, if I was pulling a sled backwards or doing any type of backpedaling, any type of moving backwards against a resistance, your quadriceps are tired, and it takes it's a lot of work on them. That's for sure.
I will definitely see your biomechanics as well. You know it, because like if you really, like you said, thinking about the mechanically perspective, if you're like kicking your shank or kicking your lower leg, what is the movement direction? It's actually going back. So it's such consistently, and nobody has done this. And so we're thinking maybe we can do that. So, but definitely, to do the first step in this study, we didn't recruit ACL patients. We are coming up a fatigue protocol to mimic what it has been done, like quadriceps and like fatigue, to mimic like quadriceps atrophies. So that's what we did here. And what we actually found from this research is exactly supported our hypothesis. The single leg backwards hopping distance is most sensitive to detect such quadriceps fatigue. And also, even though it's like fatigued, quadriceps knee demands for going back, like hopping backwards, is the most greatest compared to forward and vertically. So that's what we really supported our current ongoing research projects at KU here. And we're recruiting ACL patients to do single leg backwards hopping. And we're also recruit health groups to look at how you're using your knee.
Okay. So we kind of jumped to, she provided the results and the conclusion just there. What was, and like I said, the purpose of your study was to identify the effect, and I'm reading straight from her paper that was recently published. Purpose of the study was to identify the effect of quadriceps deficits induced by a fatigue protocol on hip, knee, and ankle mechanics, jumping performance, and performance symmetry. So looking at the variance between each leg. and single leg forward vertical and backward hopping tasks. So in this study, can you maybe talk about, okay, the methods, like talk about the subjects that you used, and then like what was that fatigue protocol?
Yep. Okay, great. So for the fatigue protocol, we first recruited 38 participants, and all those are recreational athletes. That's what we said. And it's people has like their health like injury free and having experience in performing jump landing sports. The reason we ask is like ACL injuries so common happened during jump landing sports, such as like basketball, football, soccer. So then they came to the lab, and what they did is first measured their 1RM, like maximum strength on both legs. We're trying to look at if there are asymmetries already.
Just leg extension?
Exactly,
okay.
leg extension. And then we came up with, okay, later on the fatigue will be half of your maximum like 1RM max strength on one leg. So then we have subjects performed single leg forward, vertical, and backwards hopping on both legs. That has been a baseline. And from here, we measured their like lower limb, hip, knee, and ankle work, power, movement, as well as performance on both legs.
There's your biomechanical terms.
And then we performed the fatigue protocol. So during the fatigue protocol, participants, as you can tell from this picture, like this figure here, they're sitting on the leg extension machine and having their knee as like external angle 60 degrees. So why we are picking up that is from the research studies we found during landing, that's probably the lowest position you can go, like close to that. So then
So it makes sense to use that angle.
Yes.
Yeah.
So participants was holding there for until exhaustion for 5 times, and there are 30 seconds break in between. So they're holding there that is a general like fatigue protocol.
So a fatiguing isometric contraction. You're just holding that, pushing as hard as you can.
Yep.
And your quadriceps are sapped. They're tired.
Yep. And then they are like, most of the subjects, they were like, I really like think for them, they're trying so hard. You can tell they're shaking a lot. And that's what we did as a general. And after...
And you're inducing fatigue because fatigue is such an issue after an ACL injury, right? The quadriceps have atrophied. Those thigh muscles are not as strong as they once were. They don't have the same muscular endurance. So they're very fatigued. So you're trying to mimic that in the study by gathering the baseline measurements, like you said, their hopping distance and all of that, testing their strength. Then you induce this fatigue protocol, and then now you're going to have them repeat those measurements.
Exactly.
Correct?
So actually, this testing is like one of the longest study, like testing session, like needs, because we subject actually finished about 2.5 hours. Because not only like the general fatigue, there was like 5 reps while you're holding, and after that we want to maintain such fatigue. So then participants jumped vertical, forward and backwards 5 times for each condition. And while they're jumping through their fatigued leg, they will do 1 more reps, 1 more holding right before that trials. So they actually did 35 times of holding like this. So they were like dying.
That's a lot of volume. That's very fatiguing. Yeah. But I get what you're trying to mimic here. It's like, it's such an issue, that fatigue after the injury.
Yeah, so then after the fatigue, we definitely found like the performance-wise, and you can see the bilateral differences for forward and vertical hopping is like above 90%, but backwards hopping, that is the only one below 90%. Why we really care about 90% is that is such a common like passing criteria today used by PT clinics. They're saying, if you pass the criteria, pass the testing ready to return to play after ACL injury, you will achieve at least 90% symmetry between legs so that you pass it. And,
right, meaning like the strength, whatever you're measuring, the torque maybe around the knee should be 90% of the strength of the non-injured leg.
Yeah, like make it easy, just like the hopping performance. Like if your left leg, if your injured leg hopped about, Well, I will just see metrics then. 0.9 meters, and your injured leg hopped distance for about 0.9 meters. Your non-injured leg hopped about 1 meters. The asymmetries between them is about 90%. That is somewhere they think, okay, you'll pass it.
Right. We're confident with your ability maybe to return to play because the leg strength around the knee is similar.
Yep.
Okay.
Yeah, that's today what they're using for like forward hopping.
So I guess this kind of leads to, excuse you.
Excuse me.
She wasn't feeling that good last week. I think she's better this week. Should have got you some water. So this maybe then I think leads into the results, right? So you got baseline testing, you did this fatigue protocol, which sounds brutal. Then you retested them. And so then now just results and conclusions of the study, unless there was anything else you wanted to add with the methods, but just what could a PT take away from this study? How's it applied? The take-home points. So just, your results and your conclusion.
Yep. So today based on the results, we're really suggesting using single leg backwards hopping performance as maybe at least an additional task to evaluate your knee, because it requires the greatest knee demands while you're hopping backwards. So we hope we can apply that, and to PTs. We're really having a big dream here because we think later on if we get enough data from ACL patients as well as health control groups, we can really change the field, don't hop forward anymore. You can hop backwards.
Right. Yeah.
And
hop backwards to move forward, right?
Exactly. So that's really our big dream and what I'm towards too for my research studies.
And it makes sense. Everybody try it when you get home. Just try jumping forward off one leg and then compare that to hopping backwards off that one leg. I guarantee if you do that repeatedly, like hopping backwards, you're going to really feel that in the quad, and it just you feel a greater, I guess we would call moment, or you feel greater torque at the knee. Whereas if you're hopping forward, you're still using the quads to extend the knee some, but you're also using the glutes, some of those big muscles around the hip, the calves. So it's different. I mean, it's really unique. I mean, I'm sure it's something so simple to measure the backward hopping distance and how they're performing doing that. It's wild that it hasn't been thought of before. I mean, it's simple, but it's unique. It's a unique, simple measure.
Yep, so we're very excited about it, and definitely currently collecting data from ACL patients as well as health controls. So very excited about it.
Yeah, and you have this on here. I like this this image. So single leg backward hopping showed greater sensitivity to detect quadriceps strength deficits, suggesting it may act as a better or at least an additional metric to evaluate quadriceps strength in post-surgery rehabilitation progress following ACL reconstruction. So it's not like PTs aren't going to scrap all the other assessment methods like functional assessments they use in a patient that's recovering from an ACL reconstruction injury. But this is something that could also be added in to, again, help to determine, is this athlete ready to go back on the field? Because you see it all the time now. Athletes are going back, it seems like earlier and earlier, I remember it used to be at least a year, and then it went to 9 months after the surgery, they could go back out. And then sometimes, which I think is crazy, 6 months after an ACL injury being back out there, but it seems like what's typical, 9 months, maybe to get back out there. So, well, anything else you want to add about the study, or do you want to talk about what do you want to investigate in future research?
Yeah, definitely. And I think this will really give us an idea and supporting evidence to further establish single leg backwards hopping. So currently we're also collaborating with the orthopedic surgeon group from KU Medical Center, and we actually did applied single leg backwards hopping for several players on KC Current, so who got ACL injury before. So the results I cannot use.
I think you met with Coach Potts, buddy of mine. Okay, yeah.
So we definitely, the results supported our hypothesis. I definitely see the most asymmetry for the knee between the injured and non-injured legs. And that's a study we're looking at currently, and we'll keep going. So there are steps, there are like ways to really apply things like backwards hopping in a greater I will say in the field, but definitely now there is a PT clinics, Overland Park Performance Center. We're actually having PTs to use that tasks, just to introduce the tasks to our clients, and then hopefully later on that can be something, we build on and to start monitoring it. And those are really about ACL injury risk. We are also looking at primary ACL injury mechanisms. So speak to that for the future as well as ongoing research projects. We're looking at how trunk contact can affect ACL loading variables. Because what we found previously is in sports involved contact nature such as football, soccer, and those showed more than 3 to 5 times higher injury risk compared to sports without contact nature, maybe or limited contact nature, such as maybe baseball or volleyball. Those are more.
So you're looking I think of football like a play where maybe as a receiver they jump up to catch a pass along the sideline, and they're up in the air, but they get hit in the air. Their trunk gets hit, right? Defender hits them in the side. The trunk gets laterally flexed, and then maybe they land on the left leg. So you're looking at how trunk position and forces applied to the trunk could predispose you to an ACL injury. You're looking at, and that's often not thought of because we don't think of above the pelvis. We think of everything from the hips down and what's going on at the knee joint, and but it's not. There's not a lot that I can think of out there looking at trunk position when you land, right? So then I'm thinking other things. I'm thinking training approaches. It's probably important, here a lot of things to have a pretty strong core, abdominal muscles, low back. Even quadratus lumborum on each side, and all those muscles that help stabilize the spine. Because obviously, I would think it's going to be better if you land with the spine pretty much vertical, if you can, versus being laterally flexed and deviated off to one side. Because, oh man, it's going to be a lot of load on the hip, the knee, and the ankle when you land.
Yeah, definitely. Because why we care about, as you said, most of the people looking down, what happened to the knee, or maybe to the hip, or, never thought about, look up.
Look above.
Exactly.
Because it's all one long kinetic chain. Everything's connected.
And if you think about your trunk, it's actually composed about more than half of your body weight. So for some biomechanical terms, if you easily move your trunk, it will significantly move your center of mass or center of gravity. So of course that will affect the force.
I wonder, I just thought of this. So we know males have a slightly higher center of gravity than females because males tend to be broader up top. I wonder if deviations in a male's trunk it would predispose them more to ACL injuries when they land versus, say, a female, even though females tend to have a higher prevalence of ACL injuries. But just looking at trunk position, because females tend to have a lower center of gravity, a little wider hips, not as broad up top, so their center of gravity is lower. Maybe they can stabilize if they land on one leg a little better. Even if their trunk is flexed to one side or the other than a male. I don't know. It's just a question I thought of.
Yeah, definitely very interesting. Actually, it's the same, we received a similar comments from reviewers from previous our published work. So so then we did a secondary analysis. We found that females and males actually respond to trunk perturbation. The way we call it trunk perturbation is we don't tell subjects if somebody gonna push you or pulling you. So unanticipated maneuver with an external force applied to your trunk. So that's perturbation we identified here. So females and males actually having a similar response to such perturbation. But definitely you can tell a little bit, some variables are different. We didn't really look at case by case things, but I think that could be something.
Well, and I know I had Dr. Dan Lorenz on talking about ACL injuries at one point too, and he had mentioned how also there's differences in muscle activation patterns on landing between males and females. So the strategies that a female or male may use kind of to support and stabilize that knee, it's a little different. I think there's some with the hamstrings. some activation pattern differences there.
Yeah,
So
so for sure. So yeah, that's kind of like what where brought me to look at like the really something bring my attention to look at trunk is ACL injury, like such a like big topic. Lots of people like well studied in the last 2 decades. But if you look at epidemiology study, did the ACL injury like incidence rate significantly decrease? The answer is no. So what is the missing piece here? So what we found is maybe we should look at more like indirect contact, which is contact with your other body part instead of the knee when ACL injury happen. So then we look at how like medial laterally, how trunk perturbation gonna affect your knee loading. And today with the future studies and ongoing research projects here in the lab, we're looking at how posterior pulling perturbation or your trunk being pulled back, how that gonna affect your ACL loading. Because definitely what is a major function for your ACL is to restrict your shank going forward relatively to your thigh. So we're looking at, okay, if your trunk extension, that gonna affect your like ACL loading. So that's what we're doing now and in the future.
right, it's interesting. Looking at the position of the trunk and how if the trunk is perturbed in different directions, that affects loading on the knee and on the ACL. It's really cool.
Oh, thank you.
Anything else you want to add, or you good?
Yeah, I think I'm good.
Okay.
And thank you for the interview and having taken your
Yeah,
time.
thanks for talking about your lab and all the awesome research you're doing here.
Yeah, thank you.
So how can people contact you if they have questions about your lab, your research, and your teaching?
Feel free to send me an email. My email address is pretty straightforward. My first name, last name at ku.edu. So yusong@ku.edu.
All right. Thanks for providing a tour and discussing your lab today. If you have questions for me about the KU Exercise Science program, send an email to jtaylor@ku.edu or call 913-897-8516. Thanks for watching.